reality.
What's the question you get asked most frequently?
When is it going to arrive? When can we see it?
Distributing the COVID vaccine will be a relay race.
When that first vaccine arrives, we want to be ready to move it.
Each piece of this supply chain is part of an intricate jigsaw puzzle.
How big of an undertaking is this?
This is massive.
I didn't really feel like human. You make money so that you can live, but I wasn't making enough money to live.
Basic income and policies have the potential to improve health outcomes.
I think if there's any country that can do this, we have a chance to lead something on a world stage.
Hello, I'm Donna Friesen. Everyone calls it the light at the end of the tunnel. A vaccine for COVID-19 is coming. The scientists have done the work in record time, and Health Canada is expected to approve the first one possibly as soon as mid-December. That will trigger the most ambitious and complex vaccine program ever attempted. The pressure to deliver and to do it fast is intense. Carolyn Jarvis takes us through how the vaccine rollout will happen, starting at a manufacturing facility in Switzerland, and the Canadian in charge.
Below the towering Swiss Alps, the unassuming town of Visp, home to a mere 8,000 people, is making what could be the vaccine the world is waiting for. The recipe is Moderna's, a pharmaceutical company based in the US that quickly realized during a pandemic that to meet global demand, it would need a manufacturing partner and a secondary production plant in Europe. It found both with the firm Lonza, based in Switzerland. If Moderna's COVID-19 vaccine is approved for use, this is where the Canadian supply will come from. And the man in charge of the operation, Nicolas Charnet, is Canadian himself.
What's the question you get asked most frequently?
When is it going to arrive? When can we see it?
For Canadians, the answer is early 2021.
So you're already producing the vaccine?
Yes. Canada is one of the countries that move very, very fast in securing vaccines with us. It's one of the first countries, or one of the top countries to receive our supply also.
Because Canada doesn't have the manufacturing capacity at home, it's relying on international partners like Moderna to receive its vaccine. Construction on Moderna's 4 production lines in Visp is still ongoing, but it's expected this site will produce upwards of 300 million doses by the end of 2021. And when combined with its manufacturing plant in the US, Moderna says it could make as many as 1 billion doses next year.
What does your family back in Sherbrooke say?
Hey, they're all behind us. They're telling me, hey, how fast can we get this? Because we want to see you. We want you to travel and come and see us again. And we haven't seen our family for almost a year now.
Moderna's vaccine, which it says is 94% effective, is in Health Canada's hands now, undergoing review. If it is approved for use, it will be sent to Spain to be put into vials, then shipped to Canada.
When that first vaccine arrives, we want to be ready to move it.
General Rick Hillier, who led NATO forces in Afghanistan, was recently tapped to lead the vaccine rollout for Ontario.
When you got the call, what was your first reaction?
I'm really not looking for a job. I thought about a word which is right on the new Afghan memorial right here. It says duty. Duty calls. And when your premier phones and says, can you help? You can't say no. Duty calls.
So what will your days look like?
Well, long and intense.
Hillier will be directing a team through a logistical labyrinth, coordinating shipping, storage, and perhaps most crucially, tracking who gets the vaccine and when they're due back for a second dose.
We're talking to the IT professionals. They're talking about building a system that is already in progress on iPads to use at those sites to log where the vaccines are, where they're going, to connect that to health cards to make sure that we have a record that somebody has been vaccinated.
Making sure patients return for that second dose is what worries Dr. Michael Finkelstein of Toronto Public Health the most.
We have a lot of experience with people getting vaccines, but much less experience with people needing 2 doses. And so it's going to be very important for us to be able to remind people and making sure that they get the message that you have to come back.
It will be up to each province to decide if the vaccine is administered in public health clinics, hospitals, your doctor's office, or pharmacies. and up to each one to have an IT system in place to track that. Daniel Chiasson is the president of the Canadian Association for Pharmacy Distribution Management.
If we're going to be using pharmacies, they already have that capacity in place. And so, if you get medication and your medication expires in 30 days, they'll provide you with a recall to say you're due.
How would that actually play out? Do they call you? Do they email you?
It could be all of them, all of the above. So then the question is, can we actually bridge all the IT systems from the various pharmacies or the pharmacy chains and move it up to the provincial level if they want to actually have full visibility and transparency?
Can you do that?
You can, yes. And we do that with the flu vaccine today.
Distributing the COVID vaccine will be a relay race.
Good afternoon.
And the final stretch, says Chief Matthew Pegg, head of Toronto's Immunization Task Force, will fall to cities.
How big of an undertaking is this?
This is massive.
Typically, when Chief Pegg directs an emergency response, it's done here at the city's Emergency Operations Centre. This is him in March, mere days before Ontario declared a state of emergency.
It's important that we have people here. It's important that we bring people together.
Now, Pegg directs a team of hundreds virtually.
It's a different way to work. We've all had to pivot. We've all had to pivot very quickly.
I'd love to know what the big dots are on your to-do list right now.
The biggest hurdle or biggest checkbox from a logistics standpoint is identifying all of the facilities that we're going to require, where people will ultimately be able to come to get vaccinated.
So you may have to set up clinics, meaning you might have to have a space where people could come, much like your testing facilities right now?
We're assuming that's a guarantee that we will have to do that. And then, of course, it will be making sure that we're able to identify those and set those up in strategically located around the city so that they're reasonably accessible by all of our residents, that there's good networks to get people there and back.
Chief Pegg is also looking for facilities to serve as warehouses for the mountain of inventory that just this week started landing on his doorstep. To avoid what happened in the spring when Canada was forced to fight for personal protective equipment, the federal government has signed contracts with medical supply companies Becton Dickinson for 90 million syringes and 100 million needles, and Cardinal Health for 90 million alcohol swabs, 75 million bandages and gauze strips.
What's the hardest part of this for your team?
Dealing with the volume is going to be a critical element that is going to put stress on the system.
The how much and when are still unknowns. Canada has signed contracts with 8 different vaccine makers, which could provide more than 400 million doses on different timelines, and each one may have its own constraints. Like Pfizer's, one of the other leading candidates, which has to be stored at minus 70 degrees Celsius, requiring an infrastructure some have warned Canada is not yet equipped to handle.
The bottleneck for me is at the warehouse level, do we actually have sufficient capacity with the right equipment in terms of refrigeration or frozen capacity to do it? The infrastructure exists today. Do we have enough of it?
The federal government has ordered 26 ultra-cold freezers required for Pfizer's vaccine and another 100 laboratory freezers needed for Moderna's. One of those contracts, worth $1.1 million, was signed with Thermo Fisher Scientific out of North Carolina. Dr. Alex Esmond is its general manager of cold storage.
Criticality of this is huge. Being able to manage the temperature from the point of manufacturing through distribution and ultimately to preparation for injection, it just can't be overstated.
Laurel Wiseman is the president of SB Scientific, a distribution company out of Markham, Ontario, that's also been contracted by the feds to secure freezers.
So we actually have stock already here that we've sent out to the feds, to, I think Ontario is going out today, Alberta has gone out, right across the country.
To help with the cold constraints, Pfizer will ship its vaccine directly from its manufacturing plants to 14 sites across Canada, a number the federal government says will eventually grow to 205 sites. Pfizer's vials will be put in specially designed packages using dry ice and equipped with GPS thermal sensors tracking the temperature of the vaccine as it travels. On the receiving end, Canada is readying the dry ice. It put out a contract for 20,000 kilograms of it to be delivered to 100 locations across the country every week. Each piece of this supply chain is part of an intricate jigsaw puzzle.
Daunting has become a very common word.
Come January, if both the Moderna and Pfizer vaccines are approved, the first wave of what's expected to be 6 million doses should start arriving.
So when the province says to you, all right, Chief Peg, the vaccine is here, you're going to say?
My commitment is to say, okay, we're ready to go.
But until then, there is one more hurdle: fatigue.
We're tired. I'm tired. And our team is tired.
At the front line, the days start early and go long into the night.
When you're on mission for 6 or 9 or 12 months, the most dangerous time for the soldiers is the first month and the last month.
But from the Canadian in Switzerland, manufacturing what could be the answer, there is finally reason to smile.
Of course, there's tremendous pressure, but there's also tremendous motivation. I can't wait for the day where there are vaccines out there and there's a solution for this pandemic. It's impacting everybody.
But on your end, it's coming.
Yes, it's coming. Yeah.
Coming up on The New Reality.
I think we need to be bold now. We cannot wait.
Proponents say politicians have to stop looking at guaranteed income as an expenditure.
We're investing in the kind of society we want to build. We're investing in opportunities for our children and for our grandchildren.
Welcome back. Imagine a world where every adult gets a set amount of money from the government on a regular basis. It's not tied to work or education levels. It's just a basic income. The idea has been floating around for years as a way to alleviate poverty and give every citizen a financial cushion. Lots of countries have studied it. Some have run small pilot projects, but it's so expensive, no country has adopted it. Now, the pandemic has breathed new life into those advocating for a universal basic income. Michael Couteur explores what it is and whether it will ever fly.
A casual stroll with her camera in tow was once a luxury Jessie Golem couldn't afford. 3 years ago, she was stuck in 4 dead-end jobs working upwards of 80 hours a week, and it still wasn't enough.
I didn't really feel like human when I was doing those jobs because, like, you make money so that you can live, but I wasn't making enough money to live.
Her dream of running her own photography business seemed to be slipping away as she struggled just to survive. But then the Ontario government started a basic income pilot project that provided around $17,000 a year to 4,000 residents living on low income, enough to cover basic needs like rent and food. Golem applied and was accepted.
I remember thinking to myself, I just thought, my rent is covered. My rent is covered. My rent is covered. And I just started sobbing in my car as I was driving home because I could just feel this weight of relief just lift off of me.
The stability of basic income allowed her to launch her business.
And it was working. I was actually finding that I was making more money than I was before when I was cobbling together those jobs and stressed and depressed.
But only after 1 year, in 2018, the newly elected Progressive Conservative government scrapped the project, claiming it was a failure. Golem was devastated. Dozens of other recipients felt the same way. They protested outside the Ontario legislature. Golem asked fellow former basic income recipients to write out how the program changed their lives.
There's Roland. You said you struggled with addiction and homelessness, but basic income helped him get out of poverty, and then he went to school and got into a trade. And basic income gave her just a little bit of leeway, a little bit of freedom, and a little bit of just made it easier to be able to support her child and raise her child.
Golem and her portrait series called Humans of Basic Income started touring around Ontario, then Canada. And then she was invited to travel overseas to talk about the project and how ending it was devastating.
I also watched a physical transformation of these people falling back into poverty. And that was, and still is to this very day, very, very difficult to see.
And then the pandemic hit. This is why basic income is getting so much attention now. Millions of Canadians lost their jobs, and the Canada Emergency Response Benefit, or CERB, has been a lifeline and showed what was possible. And despite the CERB, racialized and disadvantaged communities have been impacted especially hard. The pandemic exposing the inequities that already existed.
It goes without saying that living in poverty is very expensive.
Dr. Nahid Dassani is a palliative care physician who specializes in caring for homeless and vulnerable populations.
I do think that basic income and policies associated with it have the potential to improve health outcomes, but also reduce healthcare utilization, like a stay in a hospital or a visit to an emergency department.
For a fuller picture of what basic income could do, you have to head a little west and back in time nearly 40 years. In 1974, the small town of Dauphin, Manitoba became the test case for something dubbed Mincome. Researchers wanted to see if people stopped working after you gave them a basic income. Now, the model was simple. People qualified if they made under a certain amount of money. For example, a family of 4 was eligible if their total income was under $3,800 a year, or just over $19,000 in 2020 dollars. Health economist Evelyn Forget studied the program data and found those who were employed stayed employed. Only 2 groups stopped working: mothers who extended their paltry maternity leave and young men. Those teens didn't just collect the cash and do nothing. Forget says it bought them the ability to continue their education.
Well, if you think about the differences in opportunities that are available for somebody who finished grade 12 in 1975, for example, as opposed to somebody who left high school at age 16 and got an immediate job, you can imagine the different life path they would follow over the next 40 years.
Advocates believe the Canada Emergency Response Benefit, or CERB, is a big reason why basic income is finding traction now. CERB paid out $81.6 billion and helped nearly 9 million Canadians. But that benefit is not available to all those who need it. Basic income would be. The Parliamentary Budget Officer has pegged the cost of a basic income scheme at anywhere between $47 and $98 billion over 6 months. Opponents insist it's too expensive and the return on investment is just not there.
So what do you say to people who believe that a guaranteed income or a basic income will just see more people sit at home and do nothing and collect that money?
My first answer is that there is absolutely no evidence of that in any of the pilots and any of the programs that we've run.
Sheila Regier heads up the Basic Income Canada Network, one of many groups that's been promoting the idea for decades. She sees the pandemic as the perfect time to push for basic income again.
People want to do better, and all of the pilots verify that.
Proponents say politicians have to stop looking at guaranteed income as an expenditure and more like an investment.
We're investing in the kind of society we want to build. We're investing in opportunities for our children and for our grandchildren. And we're looking for returns on that investment over the longer run. And I think it's very hard for somebody who's looking to fight an election in 2 years or 3 years or 4 years to make those kinds of long-term decisions. But those are the kinds of decisions we have to make, I think, as a society.
Measuring societal success can be difficult, but in the Manitoba Mincome Project, hospital use decreased by 8.5%, which suggests healthcare savings across the country could be significant. In the more recent Ontario project, McMaster University researchers found an overwhelming majority of participants reported their health was somewhat or much better than before basic income. Political will and potential costs have prevented a livable income from becoming a countrywide reality. But this time, there is a cross-party effort to push ahead. So, we held our own town hall with 3 MPs from different parts of the country, all with the same goal.
By a show of hands, who wants some form of livable or basic income to be put into place for Canadians?
I put 2 hands up.
Oh, yes, yes.
Jenica Atwin is the Green MP for Fredericton. Leah Gazan is the NDP MP for Winnipeg Centre. And Nate Erskine-Smith is the Liberal MP for Toronto Beaches East York.
I think we need to be bold now. We cannot wait. We cannot wait for our suicide rates to continue to increase. We cannot wait for the disabled community to continue to sound the alarm that they're consistently forgotten about.
And it needs to be in addition to current and future government programs and supports, things like Medicare, affordable, accessible social housing. We need investments.
And Nate Erskine-Smith is leading a movement within the Liberal caucus to make basic income a top priority.
Let's do what we can over the coming 6 months as the CRB is still in place to develop plans to address income and wealth inequality.
Erskine-Smith points out basic income programs already exist in two forms: seniors with the Guaranteed Income Supplement and Old Age Security Pension. The Canada Child Benefit is also there for families. But he admits there is a missing middle of working Canadians who have been left behind. Seeing the cross-partisan political will gives Jessie Golomb hope, something she didn't have much of a few years ago. And she has a message for Prime Minister Justin Trudeau as he guides Canada out of the pandemic.
I think if there's any country that can do this, we have a chance to not only build a better world and lead an economic revolution, we have a chance to lead something on a world stage.
Next week on The New Reality.
The impact of COVID-19 on the brain could be conceived of as accelerating brain aging.
I didn't know who I was, where I was, and I don't know how long I was like that. I just remember coming out of it and still feeling really, really confused.
Running a bath is a treacherous thing to do now because I have to sit there and watch it because I don't know if I leave the room, if I'm going to remember that that's what I was doing.
The virus might impact the brain in certain people, impairing their activities of daily living. So this is a healthcare issue and a societal issue.
That is The New Reality for this week. I'm Donna Friesen. Thanks for watching.